If they cut our Medicaid, we would lose every hospital in our rural area, and then none of us would have health care. Not just the people on Medicaid, the people who have private insurance and Medicare. I'm a pharmacist. We took an oath to take care of people. We didn't say, no, only the rich ones.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me how many sicknesses that I have. We got all in the fields. Where else? I feel like this tapping us in the back, But why? Why when we put food on their tables? Trump promised a lot of things. I thought it will be more family values and those programs that they really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare and Medicaid will not be touched?
Yeah, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax breaks go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people that are hurting are those poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
Would be the one.
You just wouldn't have voted?
Not either.
Most people in red states, they voted to take away their health care because they thought black people and minorities were the ones who are benefiting the most from the social programs like Medicaid and even SNAP, while in reality, it is the poor white people who benefit the most from these programs. So let's have a look. Please like and hype the video and let me know your thoughts in the comments, alright? Let's get into it.
Well, it's official. Republicans are going to cut Social Security, Medicare, and Medicaid. Mike Johnson said on a radio show this week that he has a plan to cut all of those programs he considers entitlements. Name one person you think is living high on the hog from their Social Security and Medicare benefits. They talk about Medicare and Medicaid like it's a free vacation. It's health care. It's the ability to go to the doctor when you're sick. It's the ability to get chemo when you have cancer. It's the ability to pick up a prescription that you need to live. It is not cash, and it is not completely free. Social Security is our money, and we pay for Medicare out of our Social Security checks. And sometimes it's hundreds of dollars a month. Those programs barely give people the ability to eat and go to the doctor. We need to believe him, because not only did he say it, but they have already started cutting those programs. It has been the plan all along. Republicans in Congress voted for the largest cut to Medicaid in American history. Also, they could give massive tax breaks to billionaires. They cut funding to the Social Security offices, so it's harder for people to sign up and maintain benefits. And every time somebody misses a payment or is delayed in signing up, that money is gone. Republicans will not be satisfied until they take everything away from us. These are not entitlements. They are programs we paid into for decades, and we expect to get what we paid for.
So you were telling me that people are unaware, they're unaware that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid. Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair, which I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me, and they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way, and they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but everyone dies. Bitch, apparently not fucking politicians.
So 37 million children will be cut from Medicaid benefits, and the Republicans are cheering the passing of their budget plan. This is absolutely not pro-life. This is morally unconscious. This is unreal. When you look at the complexity of pediatrics, the number of children who rely on Medicaid, children with complex medical needs, children with disabilities, with chronic conditions, it's unreal that they think that that's okay to cut healthcare access for children in this country and then call themselves pro-life. So if you have a representative, I do, I live in Nebraska, I have Congressman Mike Flood will be hearing from me. I am one of his constituents, and I'm a pediatrician who's been doing this work for a long time. And listen, this is unreal. This level of hatred and a lack of care for our children in this country is unprecedented. This is unlike anything I've ever seen or had to fight against or advocate for. So this is like an absolute war on Americans' health, and this is absolutely not the party of family values. It's a complete joke.
I hope that every poor white person in America that voted for Donald Trump is having a happy 4th of July. I hope you're looking forward to your Medicaid getting cut. I hope you're looking forward to no longer being eligible for food stamps. And I hope that every rural hospital that you desperately need will be forced to close, because you all thought that by voting for him and this big bullshit bill that it wouldn't apply to you because you aren't people of color. And you white people will protect each other. And because of that racism and that horrific stupidity, I hope you experience the worst ramifications and consequences of what you have done. I hope that you experience it worse than anybody else in this world. Okay? You are all horrific pieces of shit.
Barack Obama once said, elections have consequences. And I say to the American people, elections have consequences. This big, beautiful bill is the sum total of everything we warned Trump supporters about. So many of you were voting on emotion, but not facts. You were voting on what you felt, not what was known, not what was given. The Republican Party, for Christ's sake, wrote out an entire book called Project 2025, a roadmap to what it is they wanted to achieve once they obtained power. And many of you refused to read it. Many of you refuse to understand the content that was in that book. And now, because of your ignorance, you're now in a situation where you have a president that you supported who is doing everything in his power to uproot y'all's lives. This big, beautiful bill strips the very programs that many Trump supporters benefit from, and also those who did not vote for Donald Trump. Your white, uneducated Americans who live in rural areas, you guys are going to be hurting soon. That hospital that exists in your small town is about to be stripped clean because it received a lot of government subsidies to stay open. That way you didn't have to drive miles and miles and miles to the next hospital. Now you won't have that anymore. Those hospitals will now close. This is why it's so important to vote based off of facts and not your opinion, not your emotions, and not what you feel. Because you end up in situations like this. And I say again, my fellow Americans, elections have consequences. And this is a consequence of the vote you all casted in November of last year. Live with it.
So I just lost my job. If it looks like I've been crying, it's because I have been. I worked as a domestic violence advocate at a shelter here in Arkansas. And we found out last night that only 6 DV shelters in the entire state received federal funding, and we were not one of them. So I just got back from a meeting where we learned that our entire staff is getting laid off. And there are 25 other shelters across the state having the exact same meeting, having to let all of their staff go. This means that there will be hundreds of domestic violence advocates across the state, if not thousands across the country, because I doubt this is only happening in Arkansas, who will officially be unemployed as of October 1st, which ironically is the first day of Domestic Violence Awareness Month. Not only am I personally devastated to be losing my job and my amazing friends that I work with, but this is going to be absolutely catastrophic for victims of domestic violence across the country. I am not being dramatic when I say that people will lose their lives because of this decision, predominantly women and children. Like, we've known this was a possibility all year. Like, the state knew. We have been begging our state legislators for help. We've been begging the governor, our coalition. We've been begging our federal congresspeople. It's not like nobody knew this was something that could happen, and they just let it. They didn't do anything. I don't know what's going to happen with the shelter. Our director and our manager are going to see how long they can keep the lights on and just run it with the two of them as long as they possibly can. I don't know, y'all. Go register to vote. Go support your local domestic violence shelter, because guarantee they need it right now. And if anyone knows anyone hiring who wants a girl who's smart and pretty and works hard and knows a lot about domestic violence, send them my way.
This is what happens when people vote for identity, emotion, and they believe about who deserves help instead of policies, only to end up hurting their own communities, their own hospitals, and their own food programs, Programs like Medicaid and SNAP, they don't belong to one race. They belong to millions of working Americans, our rural communities, urban people, the veterans, children, and the disabled. But in political debates, these programs are seen as symbols instead of being seen as tools of stability and even survival. They are turned into arguments about fairness and political identity, And the truth is that many of the people who rely on these programs are working families who are dealing with rising costs, low wages, or even job insecurity. But politicians, they frame these programs in a way that create division instead of focusing on who benefits and how to improve them. The conversation becomes who should not be benefiting from these programs, And this changes how people vote, even if these same programs, they support their own families, their own communities, and their own hospitals, And this is why people should be informed about what policies do so that they make decisions that align with their long-term interest and the well-being of their own communities. So thank you so much for tuning in. Be sure to like, subscribe, and share. Have a good one. I'll see you in the next video.